Supravatam Sarvebhya. We are waiting little for our MHS observer to join. But
जिस नंबर से आप संपर्क करना चाहते हैं
Sachin, Dr. Sachin sir, can you hear me?
Yes, sir, I can hear you.
I think better we start.
Sure,
people
sir.
will join at their comfort. Okay.
Okay, sir. Okay. Good afternoon and a very warm welcome to everyone on behalf of Jupiter Ayurved Medical College, Shankarpur, Nagpur. I, Dr. Sachin Borkar, Associate Professor in Rog Nidan Department, and I feel privileged to host of today's webinar. A national webinar on Sthaulya Udbodhanam 2022 on the occasion of World Anti-Obesity Day organized by Rog Nidan and Vikruti Vignan Department of our college in association with Rog Nidan and Vikruti Vignan Postgraduate Association. Today, webinar is accredited by MUHS Nashik, and it is on one of the important topic, that is Sthaulya, or we can say obesity, which is a root cause of many diseases. And to deliver lecture on this important topic, we have an expert speaker who is none other than our own respected principal, Dr. Subhas Wage sir. Also, Dr. Sampat Bhatane sir, Principal of B.R. Harne Ayurved Medical College, Thane, Mumbai, as a MHS observer for today's webinar. To moderate today's session, we have Dr. Aradhana Kande Madam, Professor in Rog Nidan Department, Government Ayurved College, Raipur. Also, we have our Chief Patron, Mrs. Tarini Nikhare Madam, Secretary, Gurudas Shikshan Sanstha, Dr. Subhas Wage sir, Principal of our college, and respected Dr. Santosh Chauhan sir, Secretary Rog Nidan and Vikruti Vidyan Postgraduate Association. I welcome all the respected dignitaries for giving their valuable time. Sir, shall we start or should I wait for Bhattani, sir?
We should proceed. Actually, I called him twice, thrice, but I think he's busy somewhere. He will be joining late, but we can start. We can proceed.
Yes, sir. Now we are going to start our main session, and it gives me immense pleasure and honor to introduce and welcome speaker for today's session, Honorable Dr. Subhas Wage, sir. Sir has done BMS from Government Ayurved College, Nagpur, MD in Rog Nidan from Shilya Ayurved College, Nagpur. Apart from these degrees, he has many degrees and diploma to his credit. He have wrote 15 Ayurved book, twice got Best Book of the Year award from Ranade Foundation, Pune, wrote 42 research articles in national and international peer-reviewed ISSN journal, revived 8 lost sites of Ayurveda and was felicitated at Latur by Ayurveda Update Gurus from the same. He is on the editorial board of ISSN journal, presented many research papers in various national and international conferences, twice got Best Paper Award, invited as a resource person to many national and international seminar and conference, took lectures for international delegates of Brazil, Portugal, and Russia. I being associated with him in the department of Rog Nidan, learning many things under his guidance, and I feel privileged for it. I'm grateful to Dr. Subhas Wage, sir. Now, I request Dr. Wage, sir, to please proceed his lecture. Over to you, sir.
Thank you very much, Sachin sir, for precisely introducing me to the audience. And today is Anti-Obesity Day. And this is the last academic activity of the year so far. We have conducted so many webinars all through the year. And on every some or other day, which was previously also on World Diabetes Day, we have conducted a webinar on diabetes, and likewise on so many of the days, we on those occasions we conducted the various types of webinars to aware the audience of the importance of that day and the nature of the disease. As a medical professional, we should know about. Now in the series, today we are going to address the one of the burning issue, that is what we are facing today, is the obesity. World's almost 15% of the population is suffering from it, and from its chronic sequelae such as ischemic heart disease, diabetes, etc. And it has become a very burning issue nowadays because of our faulty dietary habits and lifestyle factors. As you know, we all being involved in a sedentary lifestyle, and people they are using junk foods, fast foods, which are rich in trans fats, saturated fats. That's why this problem is growing, and we being person in India with type A personality, we are prone to face the diabetes. But the point is, there is in the modern world, accepted obesity as a disease in some 2015 or 16. But see, in Ayurveda, obesity as a disease is considered for 5,000 years back. They accepted it as a obesity. Sushruta in Sutrasthana, while describing the Rasanimitta Sthaulya, he had given the pathogenesis of obesity and obesity-related diseases such as diabetes and ischemic heart disease. So he is of the view that these entities, they share the common etiopathogenesis. And how true they were. The things which now modern science is endorsing. Those things are very beautifully, very scientifically explained in our ancient medical science, and world needs to pay attention towards it. Moreover, given the fact that whatever the anti-obesity medical treatment option available in modern science that is causing trouble, that is not satisfactory one, and the anti-obesity drugs which have been mentioned in Ayurveda, they hold the future promise for controlling the obesity. I'm also proud that the Rog Nidana Vikruti Vijnana PG Association, along with Jupiter Ayurved College, Nagpur, have conducted so many webinars to aware the medical students, fraternity, faculties, and the people in general. I feel proud to be part of it. With this, I will start my today's lecture on obesity, which is referred as Sthaulya in Ayurveda. I hope the slide is visible to you all.
Yes, sir, it is visible.
Okay, fine. So let us go, and you will. I have compared both the sciences and the scientific and tried to establish the scientific credentials of Ayurveda, and the Ardhana madam is calling. नमस्कार मैडम, ज्वाइन हो जाइए. अभी चालू हो गया है. ओके, ठीक ठीक ठीक, ज्वाइन हो जाइए. Moderator, our today's moderator for the session is joining shortly. Let us go ahead. So to define obesity, obesity is a medical condition in which the accumulated excess fat in the body exert negative effects on the health. It is one of the most serious public health problem of the 21st century. Almost 15% of the adult population worldwide, as I told you, is suffering from the obesity and have become the burning issue nowadays. American Medical Association had classified obesity as a disease in 2013. See, these people, the modern community, they accepted obesity as a disease very recently in 2013. And we, as Ayurveda, we have accepted it as a disease and which causes the complications, anushangina. Before 5,000 years back, people are considered generally obese when their BMI, body mass index, is above 30 kg per meter square. We will see how that is calculated, weight into height meters per square. And as I told you, obesity predisposes the individual to type 2 diabetes. Before that, the pre-diabetic condition, and then ultimately the diabetic condition, ischemic heart disease, hypertension, obstructive sleep apnea, because this weight exerts pressure on the lungs and the larynx and the entire respiratory tract also. Osteoarthritis, as it exerts pressure on the weight-bearing joints, and depression, because being obese, the people that tease you and you land up in depression, and because of many problems associated with it. Now, what Ayurveda had said, how Ayurveda had defined the obesity. As per Charka and Madhava, the person in whom there is excessive enlargement of abdomen, breast, gluteal region, and body with lethargy due to excessive increase in fat and muscle content of the body. This condition is referred as the Sthaulya, Ati Stula, obese. Most patients suffer from simple nutritional obesity, but in certain conditions like hypothyroidism, hypogonadism, Cushing's syndrome, obesity is a associated features. Now, in hypothyroidism, whereas it has been mentioned that it is associated features, now emerging trend is that actually obesity triggers the hypothyroidism. This is, and that's why the anti-obesity drugs, they act on hypothyroidism also, and it corrects the hypothyroidism. Now, more and more Ayurvedic people, they are treating hypothyroidism with anti-obesity drugs. So classification of obesity, BMI up to 18.5 to 25 is a normal weight. BMI from 25 to 30 is considered as overweight, and BMI having 30 above 30 to 35 is a class 1 obesity. BMI having 35 to 40 is a class 2 obesity. BMI having 14 above is a class 3 obesity. And it can be easily calculated now in the mobile itself. You can calculate the BMI. So etiology, as per modern science, is epigenetic risk passed on generation. Obesity gene is found on chromosome 7 and expressed on white and brown adipose tissue. It produces protein called leptin. Now, this is Bijadosha obesity due to Matru Pitru Bijadosha is also mentioned in Ayurveda. We are going to see that. And as far as brown and white and brown adipose tissue is concerned, this brown fat cells, they actually burn the excessive calories and fat. And now the future lies in this only. If the scientists are in process where that white cells can be converted into the brown cells, and this we will discuss in treatment part. It produces a protein called leptin. This is a hormone which actually governs the process of eating and satiety, when to eat and when to stop, and the disbalance between this hormone, chemical hormone. That's why the obesity ensues. How we are going to see that also. Natural selection for higher BMI is being a type, Indians being type A personality, which have a tendency to store or accumulate fat around the tummy, and that is referred as that is beautifully described in Madhav Nidana, that is the Medas Vino. Medaha Udareshu Jaya. So there is a natural predilection for it. We will see that excessive food energy intake from carbohydrates, kapakritya sarvam, that is mentioned in Ayurveda, lack of physical activity, avyayamino, adhyanshilo, this is mentioned in Ayurveda, and the sleep disturbances. Environmental pollutants that interfere with lipid metabolism. Now, as environmental pollutants as well as the insecticides, what we consume every day in our diet, now the accepted, that is beyond the accepted limit, and it has been mentioned in our parliament that our the vegetables, they have 30% insecticides, which is not at all acceptable, yet we are consuming it. Now more and more people, they are going for the organic vegetables, but still it's beyond the reach of the common peoples. Alcoholism. About alcoholism in our Ayurveda, there is a very famous quote that Varaha iva pushyati. It accumulates the fat as if like in the pig. As pig gets fatty, the humans, they get fatty on consumption of the alcohol. Because of this alcohol, there is fatty infiltration in the liver, and the fatty necrosis occurs that may ultimately land up with the fatty alcoholic cirrhosis of liver also in complication. There are eating disorders, night eating syndrome. Some people have it. Endocrine disorders such as I have told you, hypothyroidism, Cushing's syndrome, and the psychiatric disorders where people, they, because of depression or say, they keep on eating and adding to their weight. Drugs such as sulfonylureas, glimepiride, the anti-diabetic drugs, it causes weight gain. antipsychotics drugs, antidepressants. They all causes weight gain and they may induce the diabetes also. Steroids, these are the notorious drugs, antipsychotics, antidepressants, steroids, anticonvulsants. They all leads to obesity and in turn leads to the diabetes. So we need to get aware from those things. Contraceptive hormone pill. Uh, Earlier there was a fashion of taking contraceptive pill in females particularly, and 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 all of a sudden the females when I practiced and I found that why females are getting hypothyroidism, as if there is a havoc of hypothyroidism in India. Every females, they used to get the obesity. They enjoy sedentary life nowadays, and with this contraceptive pill, they keep on adding on their weight, and it predisposes to host of the diseases from hypothyroidism to diabetes. That's why, and even in fatty infiltration, and that's why these diseases are there growing in female population. They need to get aware from this instead of this using this contraceptive hormonal pill, which is very bad and disbalances the natural pituitary ovarian axis, and it also leads to the this polycystic ovarian disease in them. They need to get alert from this, and instead of using this, they should ask the partner to use condoms or other contraceptive methods, but not to go for these hormonal pills. These modern drugs, they are drugs to the same extent, but they're toxic after that extent. And most of the drugs, they have very, very bad side effects, which unfortunately the common peoples are unaware of. And to some extent, I will say that even the medical fraternity downgrades its effects. We must give modern drugs outweighing the potential benefits only, and unless until they are warranted, and should not be used. The use of antibiotics in children leads to obesity in later life due to alteration in blood flow. This is one more problem. The rampant use of antibiotics, as in some of my other lectures I told in diabetic lecture also, that the rampant use whenever it is not required in viral diarrhea or viral illnesses such as the common flu, where it is not required. What you find in all in the general practice, it's a common antibiotic is a common prescription. People and doctor even both don't wait for the body. They don't believe the body's defense mechanism. They don't allow the body's defense mechanism to get over the disease. Whether you give antibiotics or not, the common flu is going to get treated in 7 to 10 days. So we need to be cautious while using the antibiotics, and the rampant use of antibiotics should be stopped, and it should be reserved for the conditions which it demands or warrants. Personality, neuroticism, impulsivity, obesity, that this I told you. We have a type 1 personality with predilections, diabetes. The pathophysiology of diabetes was poorly understood till 1994, when Friedman discovered this hormone leptin. Until the discovery of this gene leptin by Friedman, arcuate nucleus in hypothalamus is concerned with the regulation of food metabolism and energy expenditure. One group, NYP, EGRP, this in the hypothalamus stimulate feeding and inhibits the satiety actually. Whereas other group, POMC and CART, this is coming in my way, and CART stimulate satiety and inhibit the feeding, and the groups are controlled by the leptin. This is actually NYP, these are neuropeptide, and POMC, we need not, these are very complex terminologies, pro-opiomelanocortin, and cocaine and CART is cocaine and amphetamine related transcript. So don't go into that. Just understand the mechanism only. The gene leptin inhibits NYP AGRP group and stimulates POMC CART group. Thus, a deficiency of leptin leads to overfeeding and obesity. Now, etiology as per Ayurveda, the Ati Sthaulya, Ati Sampurnat, Guru Madhur, Shita Snigdha Upayoga. Dietary factors, Acharya has clearly mentioned, Ati Sampurna, that is overeating habits, Ati Guru Bhojanat, overeating of heavy foods like meat, Ati Madhur Bhojanat, overconsumption of sweets, Ati Snigdha, overconsumption of oily and fatty foods, those which are rich in trans fats and saturated fats. Actually, Sushuda in diabetic chapter has given a list of the items which leads to the obesity. Another factor is Atistolya, Avayamat, Avavaya, Divasapna Chupajayate, that is lifestyle factors, lack of exercise, lack of sexual activity, day sleeping, and the studious person. This is relates studious person have a sedentary lifestyle, no energy much energy expenditure. In sexual activity, there is a lot of energy expenditure. Its lack also leads to the obesity. Psychological factors, Harshanitya, being happy always when there is no stress at all. Body keeps on adding the weight. It nourishes the body actually. Achintana, lack of worries, tension, etc. Those things. So life should be, there should be some kind of struggle in life to be healthy also. Another factor is Atisthaulya Bija Svabhava Upajayate, that is hereditary one from mother and father. And when we have a natural tendency, as I already told you, Medastu Sarva Bhutanam Udareshu Sthitam, Atayeva Udare Vruddhi Prayo Medas Vinam. And the accumulation of fat on tummy, this could be the triggering factor for inflammation and for its chronic sequelae as diabetes. Etiopathogenesis, these are the actually shlokas, but I will explain its. I will explain it in English. You see here, one point important, the Bija Sabhat, it is Sthul Matru Pitru Janyatvat. If the mother and fathers, they are obese, their offspring is also likely to inherit the obesity. So the meaning of all those shlokas of it, which shows the etiopathogenesis is due to the consumption of kapha increasing diet. Kapha and kapha provocatives, the kapha provocatives, they are carbohydrate rich diet. Kapha prucha sarvam prameya. In the pathogenesis of prameya we have seen. So overconsumption of these factors and these lifestyle factors, this and the sweet food juice, while the end product of these things, while traversing in the body vessels, generates fat and thereby leads to the obesity. Means alters the lipid metabolism. How we are going to see, due to accumulation of meda in all the systems, vata becomes overactive in the GI tract and arouses the hunger. And the flared agni causes rapid digestion of the food, leading to polyphagia. And the vicious cycle goes on. Body keeps on adding the fat in the tissues and in the systems, and there is obstruction of vata as per Ayurveda, Marga, and which again flares up the agni, and there is a polyphagia, which in turn leads to the obesity. This could be understood in modern light, and in subsequent slides also I have mentioned that, and in Ayurveda also it is mentioned, whatever you consume, then that turns into the fat only, and that's fat, and the altered lipid metabolism and end products, and even the sugar, glucose content, which it doesn't go into the cells because of the resistance offered. And this resistance, and the cell remain energy starved, as the glucose doesn't enters into the cell, and it signals the brain that the cell is starved, and for to have energy again, it activates the hunger signal in the brain, and the hunger is aroused. That we will see again. The clinical features: the breathlessness, the Shudra Shwas, exertional dyspnea, what we observe, increased sweating, snoring, feeling tired every day, inability to carry out physical activities, joint pains, low confidence, low self-esteem. These are all mentioned in modern science and also in Ayurveda. Feeling isolated, increased peripheral fat deposition and skin fold thickness, increased deposition of fat over abdomen, central obesity, and which is the main culprit in giving rise to diabetes and host of other diseases, increased BMI, decreased libido, Harsho, that is mentioned in Ayurveda. Impotency, erectile dysfunction, that is also Clabia, is also mentioned in Ayurveda. Impotency due to atherosclerosis of genital vessels. We are going to see this, how this mentioned in Ayurveda also. This, you see, Tamati Stulam Shudra Shwasa Pipasa Shud Swapna Sweda Gatra Daurgandya Kratan Gatra Sad Sarva Kriya Swasamartha Kapa Niruddha Kapa Medo Niruddha Marga Aurutvat Alpa Vyavayo Bhavanti. You see, Alpa Vyavaya is erectile dysfunction due to Kapa Meda deposition in the blood vessels of the penis. And Aurutta Margvat Shesha Datvana and the ischemic pathology in the different parts of the body. Bhavati Prameha Vikarana Madhyadam Prapya even can give rise to Prameha also, diabetes also. Sarva eva sarogyaha balvantaha bhavati avrutta margatvat tata atha tasya utpatti hitu pariharet. So the entire etiology should be stopped. We should stop consuming the etiology which predisposes to the this obesity. And the features: alpa pichastide, shwasam, speakastana, udar lambanam, shwasadi dorgandhyam. So this chala speaker is increased gluteal mass, pendulous abdomen, chala udar, chalastana, increased breast size, disproportionate nutrition, ayatha upchay, ayatha utsaha, lack of energy and enthusiasm. The same thing is mentioned in Ayurveda also, point to point. Shudra Shwas, exertional dyspnea, pipasa, polydipsia, Kshuda, polyphasia, Sweda, hyperhidrosis, Gatra Dorganda, bromhidrosis. Even they have said, now we know this bromhidrosis in sweat producing areas such as the armpits is because the decomposition of sweat by the bacteria. And in Ayurveda also they have mentioned the Anvaha Jantavaha, which causes this bromhidrosis. Very scientific. Nobody had explored it till. Kratan, snoring, lethargy, Gatrasad, lethargy, Gadgad Dhvani, soft voice, Swakriyashu Asamartha, lack of activities, Alpa Vyavaya, decreased sexual performance. And the famous 8 demerits of obesity that is mentioned by Charaka is Ayusha Rasa, decreased lifespan. You know all this because there are all these problems. They have a low lifespan. Java Upradaha, Java, from Java, this word Javani has evolved. The lack of enthusiasm. The alternate name of Javani is the enthusiasm. Utsaha. Krichya Vyavayata, impotency. Dorbalya, weakness. Dorbalya is weakness. Dorgandya is bromhidrosis. Svedabadaha, hyperhidrosis. Atikshuda, increased hunger. Vipasa is increased thirst. Investigations from modern point of view, BMI calculated as weight in kgs divided by height in meter square. So waist size more than 35 inches, 89 that is 89 centimeters in females, and waist size 40 inches, which corresponds to 102 centimeter in males. That is considered as obesity. So if अगर कमर का घेर बढ़ रहा है, be cautious, and वो हाथ में ऐसा करने के बाद जो मांस वो जो skin folds आ रहे हैं, you need to be cautious, and you should not allow it to rise over that. But earlier, you see this again, there is lack of awareness in India, and we need to aware the people regarding this, because now every third or fourth Indian individual is getting diabetes. People, they keep on eating the samosas, the idlis, vadas, etc. on whatever they get outside, and that is fried in the palm oil, which has the highest saturated index of 55. And the palm oil, where it is produced in Malaysia, the 40% people they die due to ischemic heart diseases, such as, and the coconut oil is equally the culprit. And the southern belts such as Tamil Nadu, Kerala, where this coconut oil is used as a food for frying these things, there is a havoc of diabetes there. Laboratory investigations, lipid profile, serum cholesterol about 200 mg per deciliter, and its constituents like triglycerides, that is about 250 mg per deciliter, shows the altered lipid profile, and we need to get cautious. Thyroid function tests, T3, T4, and TSH, particularly TSH, if 5 exceeds 5 microgram per liter, then we need to be cautious. Serum prolactin to rule out the disease affecting the hypothalamus, serum cortisol to rule out Cushing's syndrome. Sleep studies, other investigation may be required as per the complication. In Ayurveda, there is physical diagnosis by Trividh Pariksha, darshan, sparshan, prashna, inspection, palpation, and history taking. So in history taking questionnaire regarding the onset of diabetes, the food habits, family history, lifestyles, etc., that one can trace for. And in inspection, visible fat deposition on gluteus, breast, tummy, etc., that can be seen. And if the body circumference, hip waist ratio, BMI can be measured, and how the BMI is can be calculated in Ayurveda, I will show you in the next slide. There may be ants to the urine and body if the patient is in pre-diabetic condition or diabetic condition also. Sparshan, soft and untouched touch, we know. Now this how to calculate this height weight ratio as per Ayurveda, they have mentioned in ancient science also. For the how much should be the weight? Actually, this shloka actually for the age of 25 years. Savisha angula shatam purushayam panchavishe tato varsha puman samatao gato viryo tav. And the weight to be calculated is given in Brihat Samhita. I have taken that from the Brihat Samhita. And you see the height weight for the mild, moderate, and you can see the extreme. The highest height, that is 7 feet and 1 inch. The average height that height was in ancient India. Now the peoples, they are losing their height also. And for this 7 feet and 1 inch height, the weight should be, ideal weight was 144 kg. For 6 feet and 3 inch, that is moderate height, the weight was 96 kg. And for 5 feet 6 inches, the weight was 48 kg. So this is mentioned in the ancient texts. Now coming to the Ashtavid Pariksha, Nadi, Bhudar Bhatt has mentioned Nadi Sthaulya Nadika Dneya Pichla Mandagamini Krusha Munal Tandvava Kushna Ratta Pusma. The pulse is weight, slow going, thin, soft, little warm, and its movement resembles the leech. Mala, there may be constipation. Mutra could be frequent. Jiva, this could be Sam, Shabda, heavy Guru, Sparsha Shitad. Druk is unctus, and Akruti is overnourished and thick built. This you can draw from, get information from the Ashtavid Pariksha. Complications are, as I told you, hyperlipidemia, atherosclerosis, deposition of fatty fat in the blood vessels, which is a systemic phenomena. Hypertension because of that, and diabetes mellitus, ischemic heart diseases, brain stroke, fatty liver, as I already told you, gallstones and varicose veins. Obstructive sleep apnea, breathlessness, menstrual abnormalities, and polycystic ovarian disease, osteoarthritis, hiatus hernia, increased risk for cancers also, and glomerulosclerosis. morbidity and mortality, obese patients are at a risk of early death, mainly from diabetes, coronary heart disease, and cerebrovascular disease. And how true it is in our Ayurveda. While giving the 8 demerits of obesity, they have acharyas have clearly mentioned about the Ayusho Rahasaha. And how true it is. You see, greater the obesity, higher are the morbidity and mortality rates. Weight reduction reduces the mortality, hence should be encouraged. And we need to take this program, this awareness program in the masses. And I think the government of India had launched had included these lifestyle disorders in a national obesity and diabetes control program. Thyroid dysfunction and obesity. Thyroid hormones regulate the basal metabolism, glucose and lipid metabolism, as you know all. And hypothyroidism causes decreased metabolic rate, and decrease in metabolic rate leads to obesity. This we all know. Thyroid stimulating hormone is raised in hypothyroidism. So now the last point is important. Earlier it was thought that obesity is secondary to thyroid dysfunction, but now the emerging concept is elevation in TSH level may actually be secondary to obesity. And on the same ground, as I told you, many Ayurvedic physicians now treating hypothyroidism with anti-obesity drugs given in the texts. The high level of adipocyte hormone leptin found in obese individual could be the potential cause for elevated thyroid stimulating hormone. This disbalance in leptin hormone, which controls the obesity by inhibiting the food cravings and giving the feeling of satiety. Weight loss induces significant decrease in serum free T3 and TSH levels. Modification in body composition reduces the state of inflammation, which decreases the secretion of inflammatory cytokines from adipose tissue, and thereby preventing the autoimmune destruction of the thyrocytes. Now, this Ayusha, let us discuss some 8 demerits given in Ayurveda. Ayushu Rasa, decreased lifespan. In obese person, there is overproduction and deposition of the fat in the body, as a result of which the other dhatus are not formed properly, causing its deficiency. Due to this, the dhatu deficiency, the individuals have reduced lifespan. Modern researchers have shown that there is correlation between hypertriglyceridemia, vitamin D3 deficiency, and diabetes. Joprasa, lethargy. And as obese person is delicate, sukumar, flabby, and heavy, hence it lacks the enthusiasm to remain active. So Acharya Sushruta has also mentioned Bhavanshi Stulaha, and their tendency is such as if you ask them to stand, to walk, they will stand. If you ask them to stand, they will sit. If you ask them to sit, they will lie. Such is the lethargy is there. Kricha Vyavahita, sexual dysfunction. Here the acharyas were mentioning the Rasanamitta Sthaulya. In that, it had acharyas had clearly mentioned the deposition of fat, excessive fat, in the blood vessels of that which supplies the penis. Because of that, this individual they can face the erectile dysfunction or the lack of sexual desire, as there is increased production of other vital dhatus like sperms and fat deposition everywhere. Obese person cannot actively participate in sexual activity, and later on becomes impotent. Acharya Sushruta, while explaining the Rasanimitta Sthaulya in the Sutrasthana 15/32, I think, clearly mentioned that due to excessive deposition of lipids in the arteries supplying the penis, there is impotency in obese individuals. The modern research had also shown that atherosclerosis of arteries supplying the penis lead to impotency in obese and diabetic individuals. The next is Daurbalya. As the same thing as there is decreased production of other vital dhatus and accumulation of fat and kapha, only there is weakness in the body of obese individuals, and hence the power to carry out is altered. Medaha tu chiyate tasmat ashaktaha sarvakarmasu. This is mentioned by Madhavkara. While Madhavkara is the one person who has separately included obesity as a separate entity. Kapha in modern context can be correlated to carbohydrate-rich nutrient. As per Ayurveda, diabetes is also due to kapha promoting diet and lifestyle. Pramahetu kapha sarvam. Now, what things I told you earlier, that this glucose gets resistance from the cell. That's why it cannot enter the cell, and cell remain energy starved, and body sends the signal. And because for perform the activities, body needs energy. Here whatever Acharya said, medasa avrutta marutat pushyanti na anya dhatuva. The other dhatus, they doesn't get the nutrition. Modern research has also shown that in obesity and diabetes, body cannot metabolize the sugar properly to meet body's energy needs. Hence, these patients don't feel energetic and lacks the energy to carry out activities. And now this Dorgandhya, bromhidrosis. You see, very scientific description. Medasaha sveda Dorgandhya jayate jantavo krimaya anvava. This is given in Bhavaprakash and in Vangasen Samhita also. The same slok. As per Ayurveda, there is excessive sweat production in obesity. We notice that microbes grows in the sweat to give rise to bad smell, because it causes decomposition of the sweat. The body odor is most likely to occur in the body places like feet, growing, armpits, genitalia, belly, behind the ears, where excessive sweat production occurs, and to a lesser extent in the rest of the skin. As modern researchers, bacteria in the skin break down these sweat proteins into acids having unpleasant odors. That is the reason for this Dorgandhya. And this is mentioned in Ayurveda also very clearly. Sweda Badaha, the other demerit, they made the fat and the kapha having similar properties, and they being the Vishandi causes liquefaction, as a result of which there is excessive production of sweat. The sweating can be diffuse or localized to particular anatomical area. The axillary and palmoplantar sweating is common. Modern research has also shown that in obesity and diabetes, there is excessive production of the sweat. Atikshuddha. As we already discussed, that due to fat accumulation, there is increase in activity of vata in GI tract, and this vata further flares up the agni in the gastrium to cause increased hunger. The ingested diet again get rapidly digested by the flared agni and absorbed by vata, and the vicious cycle is repeated. The cellular starvation of glucose signals the brain avoids glucose depleted state, and as a result of which brain arouses the desire to eat. The vicious cycle goes and polyphagia occurs. And as there is a loss of water from polyuria and the excessive sweat, the desire, excessive desire for water, that is polydipsia, arises. As per modern research, due to increased glucose concentration in blood, body tries to expel this glucose through urine, due to which urine becomes concentrated, as a result of which osmotic pressure pulls more water in the urine to keep its concentration closer to that of surrounding tissue. Hence, there is polyuria. The body cell becomes dehydrated from the triggered loss of water, causing the thirst. And again, the vicious cycle is repeated. General management, as per modern science, the dietary modification, cutting the calories, less carbohydrates. Acharya Sushruta has told the same thing, which are the substances to be avoided, which are having the high glycemic index, carbohydrate rich, we will see that cutting the calories is what much more important in controlling the obesity. Nowadays, many people they have opened the obesity clinic only, and there they implement this program. They give very limited calories to the individuals. They ask the individuals to avoid the tea, etc., but sweet in all in most of the form, and cut down the calories to the significant extent. Also give the keto diet also, but many individuals they face some kind of uh, they uh, they don't adhere to this program, and they give up this program in between. Exercise daily activity or 150 minutes a week, uh, this actually causes the weight loss. Is sustain, and we need to have a sustained weight loss. Sustained weight loss can be achieved by the regular exercise. And because if you achieve the weight loss by dietary control, and again you don't perform the exercise, there is no energy expenditure, again you will land up in the same state. And whenever you are at a workplace, don't sit for hours together. Keep walking or keep moving. Keep moving is the key to control the weight. Actually, we have been made for to be in motion, but we have given up that since the advent of these motorcycles, motorbikes, cars, etc. All the luxurious items, not luxuries, they have become the need also. As we go to job for to the long distance places, we need that. But for day-to-day purpose carrying activities also we use that. That is bad. We should go by walking. If it is possible for us, don't go use the lift, go by using the staircases. That causes significant energy expenditure, and the lot of calories can be burned. Behavior counseling regarding eating habits, particularly night eating habits, that can be counseled. A modern weight loss medication, Orlistat is the famous one, and which is commonly prescribed. This we know, and but it causes fatty stool. And the as soon as patient stop this medication, patient lands individual lands in the same state. There are other agents, penteramine, which are together jointly used, penteramine and topiramate, bupropion and naltrexone. This liraglutide and semaglutide are the GLP-1 glucose-like polypeptide 1 medicines, which is given in control of diabetes also. And this is the newer in the series, semaglutide. But all these, they have a lot of side effects, and should be used very judiciously. Hydrogel cap taken before meals. This is the capsule having particle which gives the feeling of satiety. Vagal nerve blockade. This I don't believe. Bariatric surgeries make stomach smaller and bypass the gastrium. There are now some people are going for these bariatric surgeries wherein the pouches are created in the stomach, or stomach is bypassed, so that there is pouches are created such a way that there is feeling of satiety even with the eating this small quantity of food. So there how some people go for it. But future line is um, in this browning the white fat cells. White fat cells, they keep on adding the weight, and the brown cells, brown fat cells, they burn the calories. And the scientists is of the view that by some or other way, if they can convert these white fat cells into the brown fat cells, then probably that holds the key in controlling the obesity, and not even obesity, but its future complications like diabetes and ischemic heart diseases, atherosclerosis, and other things. So that is very important. Somehow they are not getting success in it up till now, but it could be the future aspect. So in general management, in Ayurveda, Apatarpanam, Karshanam, Utpanetu Shilajit Google. Okay, I will put it like this. In obese patients, apatarpana should be done. The overnutrition should be avoided. The rukshan and chedan dravyas, and the drying and scraping agents like Shilajatu, Trifala, Gomutra, Rasanjan, Lohoraja, iron oxide, etc. should be used as per the norms. Lekhan Basti should be given. Diet should consist of Yava, Munga, Kordu, Shama, Kuddalak. And this is given in Sushu Sutrasthana 15 of the 32. The further part of the shloka is like this. Exercise should be advocated. The acharyas again and again they have stressed on exercise, and the acharyas should have given the whole list of exercise what and class-wise exercise also, which exercise should be done. So prevention is all about minimizing the risk factor. Ataha tasya utpatti hetum pariharet. Acharya Sushruta has mentioned. So prevention is all about minimizing the risk factors. Healthy balanced eating is just enough calories to maintain the healthy weight, regular exercise. General measures, again, this is mentioned particularly in obesity chapter in Vaishaj Ratnavali, Medodikar. Physical exertion, mental exertion, sexual intercourse, walking, use of honey and night vigil. You see, many people, some they contradict about the honey. Honey is not, honey is the rukshan dravya in as per Ayurveda. Honey is not that bad. Again, the general measures, the morning warm water with honey, the prataha madhuyuktawari. It is mentioned in Vaishaj Ratnavali. We have a logic for using everything. So the morning warm water with little drops of honey, it works wonderfully. Ushna Anna Manda, that is hot soup of jawar and jawar or the old rice. And the powders of chavya, jeeraka, trikatu, hinga, chitrak powder with black salt, barley, horse gram powder, make a semi-solid sattu sattu and take it along with the curd water. Not with curd water. So this helps in burning the additional fat and controlling the obesity. Other some formulas are there: Vidanga Sunti, Yavakshar, Kantobasma, Yavachurna. This Avla Churna is equal quantity, 1 to 3 gram plus honey that could be taken. Paste of leaves of the bay, chijube, cooked in soup of rice. And decoction of Agnimantha in 20 ml quantity, or Shilajitu 2 gram plus Yavamanda. This is given in Vaishaj Ratnavali. They have used this, and now this we can control. We can conduct the control trials using these drugs as mentioned in Vaishaj Ratnavali. There are some patent the classical drugs also, and some have come with the proprietary drugs also. There are plenty of proprietary drugs in market for controlling obesity. Some few such classical drugs are Amrutadya Gugulu. This is mentioned in Vaishaj Ratnavali and Vangasena. Navaka Gugulu, Medohar Gugulu, Lohorasayana, Dashanga Gugulu, Loharishta, Trifaladya Tailam, and Mahasugandhi Tailam. This is for the Pana also and the application also. Trifaladya Tailam and Mahasugandhi Tailam. Something about preventive strategy. As I all told you, the risk factor, first risk factor is overweight. Sthulo Bhavanshi, Snigdha Shayasana, Swapnashila Prayana. The tendency, as I told, what is the tendency of these obese patients? They want to lie always. So weight control by low calorie food intake. Sarva evacha parivar sauvirak tushodak shukta maira sura asav. These are the alcoholic contents. All alcoholic beverages should be stopped. Toyaha, Payaha, all and Kruta. These are dairy products. This should be stopped. Ikshuvikar, they are the sweet contents, the sugar products. They should be stopped. The Pishtana, Yamlava, Panakani, Gramya Audak Mansani, and the meats of these domestic and aquatic animals, they should be stopped. Fruits and food with low glycemic index should be used, burning the calories with the exercise. This I already told you. And which are the foods to be used? Old shali rice, old barley, old wheat, and this Kodrava Uddalak, they are the varieties of jowar. The small grains are there. Earlier, it is said to be the food of the poor peoples. Now, the high class is after this. See how the situation keeps on changing. Shamak and Nivar, these are the Shama Chawal, Sama Chawal. That is the fine granular rice. That is also is in Marathi. That is bhagar. That is called as bhagar, like all those things. Vegetables and leaf and fruit vegetables that is to be consumed. That chaulai bhaji, giloi bhaji, poya bhaji, methi bhaji, palak bhaji, chaupatiya, sunni shannak. These are the leafy vegetables that can be used, and the fruit vegetables is panwad, padwad, baigan, karela, lauki, the tondela are the all the gourds. They can be used except pumpkin. So it is important to center diet on high fiber, low fat food, and the leafy vegetables, whole grain, fewer animal products, and refined carbohydrates and sweets. It should be restricted. The glycemic index is a measure of how quickly a food causes rise in blood sugar. Foods with high glycemic index raises the blood sugar quickly and hence should be used. The low glycemic index foods may help you in achieving more stable blood sugar, and those are which are higher in fiber content. So healthy carbohydrate focused on the health, such as the apple, watermelon, jamun, vegetables like palak, methi, tomato, bhendi, baigan, patta, gobi, karela, lauki, etc. They can be used. Whole grains, legumes, matki, moong, and low-fat dairy products like buttermilk can be used. Fiber-rich foods can decrease the risk of heart disease and control blood sugar levels. Food oils, I will tell these food oils also in next slide. Saturated fats, they are very, very bad fats. High fat dairy products and animal proteins, they should be avoided. Trans fats, there's bread like things, they should be avoided. And the high cholesterol food from dairy products or high fat animal proteins, yogurts, shellfish, liver, these all should be restricted. So this, you see, calories given by these food grains and their carbohydrate contents. Which flour per 100 gram 339 calories. Rajma being the highest 658 calories. It has 120 gram carbohydrate per plate. And moong and urad, why they moong is why better moong is and moong is also called as the tridoshag in our Ayurveda. It gives only 30 calories in 100 gram. The carbohydrate content is very, very less. So that's why moong ki khichdi, moong ka use is often prescribed in Ayurveda. Rest all have high calorie content. Now coming to the oils. Now Acharya Sushruta has advocated only 3 oils for the obese patients and the diabetic individuals. There's Sarshap, Atsi, Ingudi. Sarshap means the sarsotel, mustard oil. Atsi, that is the flaxseed or javas oil, and this Ingudi, Ingudi actually we don't use. You see, the sarsotel, the saturated fat percentage is only 13 per 100 gram, and in flaxseed, which is advocated, this mustard oil and flaxseed oil, which is advocated by Sushruta, they have the lowest saturated fat percentage, 11 only, flaxseed oil and sunflower oil, 11 only. So, as per my opinion, as this mustard oil is pittakar also, it is hot. It should be used in winter season. And though the flaxseed oil is having the less 11 only saturated fat, but it is kafagar, it should be used in summer season, and the sunflower oil should be used in the rainy season. So there should be uh, they should be keep on changing. Likewise, so this in nutshell, this sesame oil, mustard oil, rice bran oil, flaxseed oil, soybean oil, uh, sunflower oil, this can be used. But now look at the palm oil, the saturated fat content of palm oil, coconut oil, and the ghee, 52, 92, 65. And the places where this is used, palm oil, Malaysia, 40% deaths are due to ischemic heart disease. Coconut, 92. Tamil Nadu and Kerala, there is havoc of diabetes there. So this is mentioned in Acharya Sushita, which oils I already mentioned you. This is Sarshab, Atsya, and Ingudi. And Vyayam, physical activity is advocated. The physical inactivity is the second risk factor. So Vyayam yoge vividehi ashona santi meha pravruddha meha tu vyayamani yuddha krida gajaturag ratha padati charya parikraman anya vastra upas. And daily exercise for 30 minutes, 6 kilometers walking plus running if possible, at least 5 days a week. So Acharya Charaka also mentioned the same thing, the Vivid Vyam Yoga, Pragad Udvartana, Snana, Chandan Lepa, Avasekaha, means having the sun bath, regular sun bath. It charges your battery. And, there is connection between this the sun bath gives, stimulates the D3 production, and low D3 level, there is connection between low D3 levels and obesity and diabetes. This has been established now. Now, Ayurveda also says the Udvartan, and Snana, we're using this medicated paste for rubbing, and the medicated water. This is one aspect we need to work upon, and whether whether this ancient practice of such type of bath can be used nowadays also, and we can get back to the old practice and keep us healthy. This needs to be not needs to be explored, but this should be followed. Our acharyas actually made all these things. They not one some things they are made in as a ritual, compulsory, and but in the course of time, we are given all those good habits, and now we are accustomed to the Western style, and we are following Western style and getting ill day by day. And we need to get back to our roots, our culture. Our culture was developed in such a way that it take the care of our health also. So walking reduces cough and obesity. This is Acharya Sushita had mentioned that clearly. Those with high income group and having increased diabetes should exercise in the form of wrestling, playing and riding elephant, horse riding, walking, etc. Those with low income group should walk as much as possible, 100 yojan in daily division. Rest others should dig well in 1 year by themselves. This is the exercise modality which was advocated by the Acharya Sushita. We can now calculate the calories burned by each one of this exercise, and we can modulate it as per the today's era, and we can devise the instruments also to burn that much amount of the calories also. So these were the ancient exercises mentioned by Acharya Sushruta. Another small thing that can be done in which actually gives exercise to the tummy fat, that is the plank. It can be increased daily. First day with can be started with 10 seconds, and then rising up to 15 is 150 up to 150 seconds, and the abdomen shakes like this, and there is actually the exercise of the tummy muscles and the tummy fat, and actually it helps in burning the tummy fat, which is not possible by other things. The sit-ups also helps, and now there is fashion of six-pack apps. The sit-ups is also help in burning the tummy fat. Triglyceride level about 50 mg, avoid alcohol, avoid fatty foods. This is mentioned by Acharya Sushruta, avoidance of day sleeping and having the good sunlight. So thank you very much for your patient listening. I suppose the things are given these things are very nicely elaborated in my books, paper 1, paper 2, which are the textbooks for Rog Nidan, Rog Vyana. Those students who are interested, they may follow these books. They can go through this and can enrich their knowledge. I had given everything in all these books. In clinical methods, you will find how to measure the BMI as per Ayurveda also. This is entirely a revamped book, and you will find many nice things there. So thank you, one and all. And with this, I hand over for further proceedings to Dr. Sachin Borkar and our today's moderator.
Thank you, sir, for sharing a wonderful lecture with us. It was an excellent session, and I hope everyone will be benefited because of your lecture. Once again, thank you so much. Now, to moderate today's session, I would like to introduce Dr. Aradhana Kande, madam. She is a BMS, MD, and PhD in Rog Nidan, and also a professor in Department of Rog Nidan and Vikruti Vignan in a government Ayurveda college, Raipur. She has more than 23 years of teaching experience and has guided and trained many postgraduate students. She delivered many guest lectures in many national and international seminars. She has published many research papers in various peer-reviewed journals. She is the board member of Rog Nidan subject at Chhattisgarh Ayush and Health University, Raipur. She is a recipient of Dhanvantari Award, Chikitsa Vibhuti Award, and recently she received a Lifetime Achievement Award on occasion of Global Ayurveda Day at Nagpur, organized by Dhanvantari Jayanti Samaroha Samiti. I first congratulate Madam for this award and welcome you and requesting you to please proceed further. Over to you, kindly, Madam.
Namaskar. Thank you very much for giving me this opportunity to moderate the lecture of Dr. Subhash Wage sir. He is very intellectually represent his topic, and really obesity is the 21st century epidemic, is a global problem, and it will be the major cause of death and disability in future. Really, it is more common in those who are naturally fat than in the lean. Wage sir, I am really appreciating you. You are not only describe the causes of obesity in Ayurveda as well as modern point of view. You all describe the causes of obesity, the exogenous factor, endogenous factors, and other factors which are responsible for the obesity. और ओबेसिटी जो है एक स्वतंत्र रूप से और परतंत्र रूप से अन्य डिजीजेस के रूप में भी और अन्य औषधियों के सेवन के पश्चात जो ओबेसिटी के लिए डिस्क्राइब किया कि कैसे हमारे आचार्यों ने जो है उसका ओबेसिटी के निदानों का वर्णन किया है। उन निदानों में आपने स्पेशली मैं बताना चाहूंगी जिसको आपने तदति स्थौल्यम अति संपूर्णात् गुरु मधुर शीत स्निग्ध उपयोगात् अव्यायामात् अव्ययावात् दीवा स्वप्नात् हर्ष नित्यत्वात् चिंतनात् बीज स्वभावात् उपजायते। इन सारे कारणों को आपने बहुत अच्छे से उल्लेख करते हुए इसका मॉडर्न से पूरा कोरिलेशन किया है। और सचमुच में यदि हम इन सारे कारणों को देखते हैं तो ये सारे कारण जो 5000 वर्ष पूर्व हमारे संहिता में वर्णित है वो आज वो सारे कारण शाश्वत रूप से आज भी उपलब्ध है। तो इसमें हम विशेष रूप से देखते हैं कि आचार्य चरक ने अष्टौनिंदितीय अध्याय में स्थौल्य का वर्णन किया है, उसके बाद उन्होंने संतर्पणीय अध्याय में इसका वर्णन किया है। और यदि देखा जाए तो आचार्य चरक ने आहार के अति सेवन मतलब एक्सोजेनस फैक्टर जो है उसको उन्होंने इसको गंभीरता से उठाया है। और यदि सुश्रुत के कारणों पर विचार करें तो उन्होंने स्थौल्य और कार्च को रस निमित्तज माना है। तो रस जो उन्होंने एक्सोजेनस फैक्टर जो है उसके ऊपर आचार्यों की अपनी अपनी शैली है, अपने अपना अधिकार है। कोई कोष्ठ में रह करके जो है आचार्य चरक जो है वो कोष्ठ में स्थित रह करके विचार करते हैं तो वो एक्सोजेनस फैक्टर्स को देते हैं, और आचार्य सुश्रुत जो है वो शाखा में बैठ करके विचार करते हैं तो वो एंडोजिनस फैक्टर्स पर महत्व देते हैं। उसके बाद माधव निदान ने इसका जो है अलग स्वतंत्रता से वर्णन किया है। आपने बहुत ही बेहतरीन तरीके से इसके जो मॉडर्न उपाय थे ओबेसिटी को क्लासिफाई करने के, अकॉर्डिंग टू BMI, अकॉर्डिंग टू योर बॉडी मास, वेस्ट सर्कमफेरेंस, वेस्ट टू हिप रेशियो, रिलेटिव वेट, आपने सारों को एक एक करके डिस्क्राइब किया। माइल्ड मॉडरेट को भी आपने सारा डिस्क्राइब किया, और डिस्क्राइब करने के बाद आप जो मैनेजमेंट पोर्शन है, क्लासिकल फीचर्स भी है, सॉरी आई एम फॉरगेटिंग द क्लासिकल फीचर्स ऑफ द ओबेसिटी है, जिसके एक एक क्लासिकल फीचर को आपने अयथा, उपचय, अनुत्साह, जवोपरोध, आयुषोहास, इन सारों को आपने डिस्क्राइब किया, और साथ ही साथ मॉडर्न से इसको कोरिलेट करते गए कि मॉडर्न में ये कैसे फीचर्स जो है, आयुषोहास जो है वो ओबेसिटी के कारण होता है, और ओबेसिटी में लेप्टिन हार्मोन का क्या रोल है, हाइपोथैलेमस का क्या रोल है, और एंडोक्राइनल ग्लैंड में आप हाइपोथायराइडिज्म से कैसे कोरिलेट कर सकते हैं। और हमारे आचार्यों ने उस समय या आज जो हम ओबेसिटी एंटी ओबेसिटी ड्रग जो प्रिस्क्राइब करते हैं हाइपोथायराइडिज्म में, वो कितनी सटीक होती है, इसका आपने बहुत ही सटीक वर्णन किया। साथ ही साथ ओबेसिटी का जो आपने मैनेजमेंट पोर्शन है, डाइटरी मैनेजमेंट एज वेल एज इन मॉडर्न पोर्शन एज वेल एज इन आयुर्वेदा, you are very well described all the portions. And exercise therapy, you are touched very muchly for exercise as Bhav Prakash, as Sushruta, as Madhav Nidan and other references. The behavioral therapy, how to control your behave, and pharmacological जो therapy है anti obesity drug, वो आपने मॉडर्न की, साथ ही साथ आयुर्वेदा की जो है वो भी बहुत अच्छे से डिस्क्राइब किया। एक जो चीज है इसमें आपने जो ये एक मुझे आपके जो डिस्क्रिप्शन है इसमें बहुत अच्छी लगी कि आपने जो हाइट एंड वेट रेशियो एज पर आयुर्वेदा किया है, वो स्टूडेंट्स को एज वेल एज टीचर्स को बहुत ज्यादा काम आएगा, बहुत वो फायदेमंद है हमारे लिए कि वो रेशियो को हम अपने क्लिनिक्स में, हम अपने लैब में वो लगा कर रखें, जिससे सारे स्टूडेंट्स जो है वो हाइट एंड वेट रेशियो एज पर आयुर्वेदा जो है वो देख करके उससे ओबेसिटी का असेसमेंट कर सकें। और मैं एक और चीज कहनी चाहूंगी कि जो आपने ये बताया कि TSH हार्मोन जो है वो यदि एलिवेटेड है तो वो कॉज करता है ओबेसिटी को, और ओबेसिटी कॉज करती है हाइपोथायराइडिज्म को। तो ये एक चक्र है जो हाइपोथायराइडिज्म और ओबेसिटी का चक्र चलता रहता है। और हमारे आयुर्वेद में तो रोगापि सर्वे मंदे अग्नो माना है, पर यहाँ पर हम एक खास बात देखेंगे ओबेसिटी को, तो मेदो रोग के अंतर्गत आचार्य माधव ने इसको वर्णित किया है, और चरक ने इसका इतना क्लासिकल एक श्लोक दिया है कि अति शुद्धा मेदसा आवृत मार्गत्वात् वायु कोष्ठे विशेषतः चरण संधुष्य अग्नि आहारम शोष्यत्य अपि। मतलब अति शुद्धा जो है वो हमारे यहाँ क्यों होती है, सारे रोगों का कारण जो है वो हम ये मानते हैं कि रोगा सर्वे अपि मंदे अग्नो है, लेकिन यहाँ देखते हैं कि जाठराग्नि जो है वो प्रदीप्त है और मेदो अग्नि जो है वो मंद है। तो यहाँ पर हमको एक बहुत क्लासिकल चीज देखने को मिलती है। और जाठराग्नि जो है वो कैसे प्रदीप्त है, इसके लिए आचार्य माधव कर के ऊपर जो व्याख्या लिखी है श्रीकंठ जी ने, उन्होंने पवन कुंभकार न्याय का सहारा लिया है और ये बताया है कि जिस प्रकार एक कुंभकार जब ईंटों को पकाता है तो ऊपर से मिट्टी का आलेपन कर देता है ठंडी, तो उसी प्रकार जब मेद से सारे स्रोतस अवरुद्ध हो जाते हैं तो वो वायु और अग्नि जो है उसकी गति कोष्ठ की तरफ हो जाती है और वो संधुष्य कर देती है अग्नि को, और जिसके कारण क्षुधा तृषा आदि जो है वो अति मात्रा में रोगी में होते हैं। तो बहुत बहुत धन्यवाद सर, आपने बहुत ही 1 घंटे के समय में लेकिन सारे पक्षों को छुआ है, और सारे पक्षों को न केवल छुआ है बल्कि इलैबोरेट करके उसके एक एक पक्ष को समझाया है। उसके लिए बहुत बहुत धन्यवाद आभार आपका। थैंक यू वेरी मच।
Thank you, madam, for
Thank you,
moderating
madam.
this session.
Yes. So, Sachin,
Yes.
before we come to the closure of the session, we are having one more legendary personality of Udbodhanam with us, Dr. Dipti Parashar madam, who is the HOD of the Udbodhanam and the faculty dean of Shri Krishna Ayurveda University, Haryana, Kurukshetra, Haryana. We would like to have her comment on the topic as well as and for regarding the activities of Rog Nidan Vikruti Vigyan PG Association. So kindly invite her gracefully on the dais. Dipti Parashar madam.
I would like to request Dr. Dipti Parashar Mehta madam to please say something about today's webinar and about Rog Nidan Vikruti Vigyan PG Association also. I welcome madam. Please proceed further.
नमस्कार मैडम।
नमस्कार मैडम।
मैडम नमस्ते।
मैडम नमस्कार वागे सर and all the audience. Thank you sir for giving me this opportunity to comment on today's webinar. So I highly appreciate the efforts which this association is doing for the academic purposes. So I attended the whole lecture and really the Ayurvedic and modern both fusion was very nice, and I hope the students will get regarding this topic and regarding this subject, this association. I would like to say that जो academic activities ये रोग निदान विकृति विज्ञान पीजी एसोसिएशन कर रहे हैं ये बहुत ही अप्रिशिएबल है, और जो वेबिनार्स के द्वारा या फिर अभी जिस तरह से जो अवार्ड फंक्शन हुए हैं या जो पीजी रोग निदान के जो उन लैब फैसिलिटीज के लिए या और भी जो हमारे जो डिमांड के लिए जो कार्य हो रहा है तो इसकी मैं सराहना करती हूँ। और हम इस एसोसिएशन से जुड़े हैं ये हमारे लिए भी बहुत ही गौरव की बात है। और जो आज का लेक्चर जो वाघे सर का डायबिटीज ओबेसिटी पे जो स्थौल्य पे जो था वो बहुत ही प्रासंगिक है, क्योंकि आज के समय में जो हम देखते हैं कि ओबेसिटी जो है ये बहुत ज्यादा बढ़ रहा है, और ओबेसिटी से होने वाले जो विकार हैं, डायबिटीज है, हाइपरटेंशन है और आईएचडी, तो इस तरह के जो विकार हैं जो बहुत ज्यादा बढ़ रहे हैं उसका मेन कारण जो है ओबेसिटी है। और ओबेसिटी का जो मेन कारण है जो हमारा डाइटरी जो जंक फूड्स और लैक ऑफ एक्सरसाइज वगैरह है, तो इसको बहुत ही विस्तृत रूप से जो है वागे सर ने आयुर्वेदिक एस्पेक्ट और मॉडर्न एस्पेक्ट दोनों का ही समन्वय करके जो है निदान मतलब जो इटियोपैथोजेनेसिस है वो बहुत ही अच्छे से समझाई है, और इवन जो है चिकित्सा सूत्र भी जो है वो भी बहुत अच्छे से दिया है हमें। तो बच्चों को, स्टूडेंट्स को, छात्र और जो फैकल्टी है सभी को इस आज के लेक्चर से बहुत लाभ होगा, ऐसा मैं मानती हूँ। और जो ये एसोसिएशन जिस तरह से ये एक्टिविटीज कर रही है, तो आगे भी इस तरह से ये एक्टिविटीज सभी के लिए, छात्रों के लिए और आयुर्वेद के लिए कर रहेगी, ऐसी मेरी शुभकामनाएं हैं। और इन्हीं शुभकामनाओं के साथ बहुत बहुत धन्यवाद मुझे आमंत्रित करने के लिए। थैंक यू सर।
Thank you, Dipti madam, for valuable inputs and sharing your precious time with us.
Sachin sir, MUHS observer Dr. Sampat
Yes.
Patane sir, respected sir, had joined the session, and let us take a review from him also.
Sure, sir.
Thank you, sir.
Welcome, Dr. Sampat Patane sir.
Yeah.
And I would like to request you to say something about today's webinar.
Yeah. Thank you very much. Thank you very much. I'm extremely excuse me because I joined a bit late. That admission process has been started for the UG, and it's a bit busy, and that's why I couldn't join in time. However, it's a privilege and a pleasure to being as a MHS observer. The K.R. Pandav Medical College and their trustees and my beloved friend Dr. Subhash Wage, principal, and his team.
One correction, Jupiter Ayurveda College.
Yeah, Jupiter. Yeah. Sorry. Extremely excuses. So Jupiter Ayurveda College, the trustees and the whole team, and the Subhash Wage sir. And this is the last webinar I'm attending online, being as a MHS observer. First of all, I would like to extend my thanks to the university, the Vice Chancellor ma'am, the Pro Vice Chancellor sir, the faculty dean, the registrar sir, and the whole authorities who is looking after these arranging and granting the accreditation to the such webinars to the colleges also. If I put the whole scenario of the webinar in a nutshell, it's a big achievement for the Jupiter College, and the great initiative has taken by Dr. Subhash Wage sir. I have gone through all the lectures, and this lecture only I couldn't join in a time also. I observed there is so many things, while because when we assess all this kind of the webinars, so the participants, the arrangements, the technology which have been used, the kindness, all those things, if I put in a nutshell, it's a great success to the Jupiter College, and I will convey my words to the university also. It's a good the efforts have been taken, and the knowledge disseminated to the students. The basic backbone of our system is our coming aspirants, the students one, and they should get the the fine knowledge and the skilled the persons who is commenting on that, and the commendable persons also. Like this seminars, definitely surely the future will be the bright of the students who were studying in the Jupiter lesson, who were joined during this webinar and the whole series of the webinars. It's a great success to the Jupiter College, and once again I thanks to the all trustees, and the especially my dear friend Wage and his team also. They have given opportunity to be to me, and they tolerated me as a MHS throughout the series also. And if anything I left anything to be comment on that also, I excuse me, and once again very thank to the all whole team. Thank you very much, sir.
Thank you so much, sir, for being with us throughout our webinar series as a MHS observer. I am grateful to you on behalf of Jupiter Ayurveda Medical College. Thank you so much, sir.
My request, Wage sir, this
Yes,
is
sir.
one request to you. Please send me throughout the series the material that has to be handed over to the university. That's the point.
Yes, sir. Yes.
So all the material of the speakers and this in the form of soft copies, and the relevant documents to be sent to me. So I'll make a report within a time and will be submitted to the university, sir. Thank you very much.
Okay, fine, sir. It's time to say thanks to everyone. Bhatane sir, who joined our entire circus, the entire webinar series, what we conducted most of the time, only for I think for the diabetic lecture and for the ECG workshop or ECG CME, he was not there. Otherwise, rest of the and I think one for this. Which one we have conducted again, Sachin? Earlier one?
ECG workshop, sir.
No, ECG. Now other one.
Another one was from the Department of Thai Chikitsa.
Life saving those things. I think Ravi sir had conducted.
Yes.
Yeah.
That was offline.
Yeah, that was offline because. So barring those two, other for rest of the events, Sampath Bhatane sir was the MHS observer, and I thank him from bottom of my heart for patiently listening to us and witnessing the whole of the event and remaining present all through the event. Recently, I got a chance to meet him at the Ayurved Parva conducted by the Ayurved Vaspit, and it was the great meeting him. I thank you, sir. I thank Aradhana Kande madam who had spared her valuable time with us, who is the one more legendary personality from Rognidana, and so very friendly to me. I visited her place and I observed the activities done by her department and what the work she is doing for the development of Rognidana subject. I appreciate all such persons, and other person who joined today is the T. Parashar madam, who is the faculty dean of Rognidana at the Kurukshetra University. I thank Dipti madam for joining the event, and all the Rognidana persons who have joined the event. I thank all of them from bottom of my heart, and all the students who have benefited from this webinar series. I request them to keep on joining such events and enrich their knowledge from time to time. And I thank my friend Sachin, who is my colleague in the department. We have executed this entire responsibility very well. And I also thank my vice principal, Dr. Shrikant Hadore, who had provided the technical assistance for conducting for the whole webinar series. I also thank my friend Dr. Santosh Chavan, who is the secretary of Rognidana Vikudvidan PG Association, and my entire executive council and team of RVPJ for successfully conducting this webinar series. I also thank our respected secretary Tarini Nikhade madam, who had given us a chance to conduct this webinar series and who always encourages and supports us for conducting these constructive activities offline also and online also. I thank her also, and she is the backbone of our college. I thank everyone. I take this opportunity as we are coming closer towards closing this entire series, and we are coming to an end of the academic schedule for this year, and probably we will meet in next year with a renewed zest and renewed enthusiasm. With this remark, I thank everyone and looking forward to meet you once again in 2020.
Thank you, sir. Patil sir, thank you very much.
Namaskar, sir. Thank you very much. Thank you very much.
Namaskar, madam.
Sachin, you can conclude.
Okay. With the permission of principal, sir, I declare here that the program is concluded over here.